Hi, this is Korey from Align Therapy. I'm here with Annie, who has graciously volunteered to meet us here in our clinic to demonstrate the expansion technique. A question that we often get from both our patients, young and old, and from other healthcare providers, pediatricians, surgeons, is you teach people that they can kind of breathe into one side of their body. Is it possible that you can breathe into one lung and not the other? So I'm going to try and answer that. And the answer is yes and no. And it comes down to mechanics. We can get into the nitty-gritty of it. I'll start with the fact that in our body we have tissues that contract and relax, but we also have tissues that do not. We cannot contract or relax them. Lungs are not tissues that we can contract and relax. They are in fact inert. There are no muscle tissues in the lungs except for those that are in the vascular structures that provide blood supply to those lungs. But neither you or I can control the constriction and dilation of those blood vessels. What we can control is the muscles that surround our rib cage, the intercostals. They're between each rib. We can also control the other accessory muscles, including the scalenes, and we can control our diaphragm. The work of breathing is done by these muscle groups. When those muscles contract, they allow air from the atmosphere to enter into the lungs and expand. And so if we can learn to control the movement of the rib cage and control the pressures below the rib cage using the diaphragm, we can learn to essentially breathe into one lung versus another. It's never completely empty. When I'm asking Annie to expand the front part of her rib cage forward and the back part of her rib cage on the left side backward, we're using both lungs to do that. And it's done through conscious effort, practice, and just with a little bit of knowledge, you can feel empowered to do that. So we use this expansion technique to counteract the rotational forces caused by the scoliosis that most scoliosis patients suffer from. You'll know this because maybe if you have scoliosis or your child does, you notice that when they bend over, they have a little hump on their back. Could be 2 humps on their back, could be 3. That is due to the rotation of the spine. And we try and control that using breathing and position with the Schroth Method. So in the Schroth Method, in different positions, this is supine that we have Annie in. We got her into position already. She's trying to lengthen her spine. She's placed a pad underneath the right side of her torso at the apex of her curve, which also happens to be the highest point of the rotation in a rib cage, to provide a passive correction of the rib cage forward. And now we're asking her to breathe and elongate the spine and try to expand her entire trunk, but amplify those expansions into the areas that need further correction, which include this left side of her curve, the concavity, where naturally her ribs actually want to go forward because of the rotation of her spine. So we're asking her to expand this rib down, outward and down. At the same time, this beanbag here is a cue for her to try and expand the ribs forward, away from that rotation that's driving her shoulder blade back and sticking that backward. By doing both together, we have a power couple that drives rotation and derotation of the spine to a more normalized postural position. To facilitate the conditioning of the muscles to do this, we ask her to do this for 15 minutes, and we give her several positions to choose from each day to work towards doing 1 or 2 positions for 30 minutes a day, 5 days a week. But at the same time, when she gets out of this position, I'm going to have her sit up and try and think about what feels different. Most patients will feel that they are longer, taller. When they breathe normally, they feel more open in the sides of the concavities that are often collapsed because of the curve. They feel like they're looser because those muscles have been lengthened that are normally contracted. And overall, it just feels easier to hold the posture that gravity naturally just wants to break her out of because of the scoliosis. And so by doing this and committing to it, it is repetitive, but through that repetition, we condition her body to hold a specific posture, specific to her curve, in an effort to reduce the risk of scoliosis progression as she ages, improve the way she looks physically on the outside, the aesthetic, and it improves her body awareness, which some of the beginning efforts from physical therapists and other healthcare providers for most patients that come in with pain is body awareness, beginning with breathing. All of that is incorporated with the Schroth Method. If you have questions about the Schroth Method, you can visit our website. We have a lot of blogs, great material written by our therapists here. And we'd love to answer any questions you have. Reach out to us, follow the links below. Thanks, you guys.